you ever sit down to dinner and when the sizzling steak comes out, wonder to yourself, did this cow end up here because it had a prolapse? Well, if you don't, you can now, or you can at the end of this episode, because today we are going to talk about prolapses in cattle. I'm Dr. Nathan, and you're listening to Vet Talk, the veterinary podcast. Prolapses can occur in any species. I've fixed them in dogs, cats, goats, pigs, and ducks. I've at least attempted to fix them in chinchillas, though that gets tricky, so I won't claim success with that one. But what am I talking about when I talk about a prolapse? In cattle, there are three types of prolapses: vaginal, uterine, and rectal. In each of these cases, the specific structure involved comes out of its normal position and out of the animal. For example, in the vaginal prolapse, the vagina comes out and is hanging out of the animal. In a uterine prolapse, the uterus and vagina come out. In a rectal prolapse, the last part of the intestinal tract is pushed out of the anus. How's that steak you were thinking about sounding now? So how do we deal with prolapses? Well, as a farmer, the first thing I want you to do is catch the cow. You need the cow up in a pen for you to evaluate and me to work on. It's quite the sight to see a cow running away from the veterinarian with her uterus bouncing behind her, so please get her up in a pen and not the open field. Preferably, we would have a head gate, but often these animals are down and don't want to get up, and can be worked on with just a stall. But anyway, as the farmer, you have went out and noticed something hanging out of your cow's rear end. You're going to call me and I will have you answer a few questions. The first will be, what hole is this weird tissue coming out from? It's kind of scary how many married cattlemen get this question wrong or don't know the difference between the two. There's only two holes in the rear end, the anus and the vagina. I like educating people, but at a certain point, I feel these questions cattlemen should ask their wives, or maybe they already have and the wife doesn't care to clarify. I'm not here to judge. But for my purposes, I need to know if this tissue is coming out the top hole or the bottom hole. The top hole, only feces should be coming out. The bottom hole, only urine and babies should be coming out. But figuring out which hole is rather critical because that helps me manage things. If it's the top hole, it's a rectal prolapse. This requires a small surgery, which I will discuss later in the episode, but as it's the same as the vaginal and uterine prolapse surgeries, but just with the anus. But then it will often require some management discussion. In general, rectal prolapses occur because of straining, so we have to treat an underlying problem to stop the animal from straining. Often this is diarrhea caused by parasites. So I'll come out, complete the surgery, and then deworm an animal. Typically also gives the animal some vitamins and potentially a steroid if I feel I need to reduce some swelling. It's the bottom hole we're more concerned about, because if it's the bottom hole, we're talking about a vaginal or a uterine prolapse. What do you think my next question is? I bet the vet students are asking about hamburgers right now. Oh, so close, but alas, so far. My next question on the phone is your cow pregnant? Why is that the next question? Let's talk about the anatomy a bit. If you go into the vagina, you will see the exit of the urethra, where the cow's urine comes out, and then you will travel further back to find the cervix. This is the opening from the vagina to the uterus. The uterus is where the baby is held. So, what's important about that? If the cow is pregnant, there is a lot of weight in the uterus. If the cow is pregnant, that calf's weight is holding the uterus in place, so you won't have a uterine prolapse. You will just have a vaginal prolapse. Okay, now to hamburgers, because vet students love hamburgers. So let's say the cow isn't pregnant or just had a calf. Well, there's no weight holding the uterus in. So now it is possible for the cow to have a uterine prolapse. So then what is my next question? Do I see hamburgers? Hamburgers? What do you mean, Doc? Have you been at McDonald's too much? Well, I prefer Wendy's or Five Guys if it's a special occasion. But in the uterus, there are placentomes, which are composed of two parts, a cotyledon and a caruncle. This is how the mother sends nutrients to her calf while it's still in the womb. When the placenta comes out, the cotyledons are gone with it. These cotyledons form a C or a cup shape which goes around the caruncle, which are on the uterus. The C-shaped cotyledons go around this caruncle. The caruncle is what is most easily described as looking like a hamburger attached to the uterus. If you see caruncles or hamburgers, you've got yourself a uterine prolapse. So now, how do we deal with these two types of prolapses? First, the vaginal prolapse. This just looks like pink flesh hanging out of hole number 2. I've seen vaginal prolapses occur up to 2 weeks before birth, occasionally even 4 weeks. But what is happening is the cow has started straining, and that straining is causing the cow to push its vagina out, which is just pink fleshy tissue. Often owners call and tell me they see this when the cow is laying down, and then when the cow stands up, it disappears. When the cow is sitting, the weight of the calf pushes on the vagina, and the vagina pops out of hole number 2. Then when the cow stands, the weight of the calf in the womb pulls the vagina back in as the calf shifts lower in the body. I'm not really concerned about these cases. I usually tell the owner to monitor the cow and know that birth is approaching. A lot of owners get concerned that infection will occur and the vagina will get damaged. While this is a possibility, I just don't see it happen a lot. If the owner is concerned, I tell them to bring it in the barn and flush it off with water daily, keeping it clean. But in general, cows are fine. Sometimes I have seen vets complete surgery to keep the vagina in. While I don't disagree with this if the cow is well managed, I actually don't recommend it. I'd rather deal with a little tissue trauma than potentially a lost calf. What I find is if I close the vagina and the cattle farmers are not watching closely enough to pull the sutures from the surgery out when the calf starts coming, then we end up with hurt cows and dead calves. Because if the sutures are still in, it prevents the calf from coming out. And I've seen too many cases where the farmers aren't paying close enough attention, and we have lost both animals from the trauma that results. So I tell farmers to just leave the vaginal prolapses alone and clean if necessary. Are the animals that have a vaginal prolapse more likely to have a uterine prolapse? I can't say I have seen that in practice. I'm always concerned about that and tell farmers after these animals calve, I'm happy to come out and complete the surgery to prevent prolapses from occurring. But no one has ever had me back out, so I don't think it's actually a big deal. Not that it can't happen, but prolapses occur due to straining. When the calf is out, the straining stops, so the problems stop. But let's say the calf is out and there's a vaginal prolapse. Then I want to get that sewed up before it becomes a uterine prolapse. The first thing I want farmers to do after they've gotten it in the pen or in a stall or something is cover the vagina or uterine prolapses that need to be repaired with sugar. Just plain granulated sugar from the house. These prolapses have fluid flowing into them from the body, but the fluid is not exiting, it's just building up, so they're going to start to swell. As they swell, it makes it harder to replace them. The sugar will draw the fluid out and keep the prolapse smaller and hopefully easier to replace, which gets us to the uterine prolapses. Uterine prolapses. These are usually not a good thing. The uterus is bigger than you think, and I've had uterus laying on the ground that seem almost as big as me. So how do you get these things back in? Well, perhaps a little luck, but it's best to set things up to your advantage. Sugar being the first step for the farmer to do. But if they haven't applied it by the time you arrive, it's probably not going to make much difference in the time you are working. Try to use gravity as your friend. Otherwise, you're going to be sweating and covered in blood and urine and placental juice. My favorite time of replacing a uterus, because it became so easy, was when a farmer missed catching the cow's head in the head gate and it caught its hips. The cow fell on its front and its butt was pushed up in the air. I climbed up on the chute and slid the uterus back in about 15 seconds. That was because gravity was on my side, pulling things back into the hole. Some people will lay a cow down or stretch its back end to cause the same effect. I'm not quite that brave. What I typically do is lubricate as much as I can. With my left hand, I will find the center of the uterus and apply pressure in the center at the cervical area. This sends tissue back the opposite way it came out. Then I will use my right hand to push the sides in as I am working. Just working on the sides alone will get you nowhere. Remember, you need to apply pressure in the center. I don't typically sedate the cow for this or do blocks because I tend to like the cow able to use its back end. Sometimes it's slow going, but often I can get the uterus back in. And yes, it will be a dirty uterus, and there will be some tearing of this friable tissue. Just keep going and get it in. Likely, there will be blood. If there's too much blood from one of those big arteries in the uterus that gets ripped, the cow likely won't make it. But often, what looks like a lot of blood to you and the farmer isn't that much for the cow. I don't give antibiotics, and the cows are not dying from infection. I also don't give antibiotics in case the owner is going to try to ship the cow. Once the uterus or vagina has been replaced, you will likely be urinated on. So step back for a second to avoid the urine, but keep your arm inside the uterus to make sure all the stuff you just put back in doesn't come back out. When the uterus is on the outside of the cow, it generally occludes the urethra, and once you relieve that pressure by getting the uterus back in, the bladder wants to be emptied. This is actually good because sometimes the cows stop straining when the bladder is emptied, and some cows do strain a lot. So while you are trying to get everything in, hold steady against the straining, but don't push against it. You will lose if you try to overpower this cow straining. Sometimes you need to keep pressure on the uterus once it is back in for the next part, the surgical part. So continued contractions or straining by the cow doesn't push all your hard work back out. The best thing to hear is that resounding sucking of air and a plop as the uterus falls over the pelvic brim, and you can use both your hands now to complete the surgical part. So the surgery itself. Basically, I use a Buhner needle to complete a Buhner stitch or a purse string stitch. I will take my umbilical tape through the needle. I typically start on the right side, where about an inch lateral and 3 to 4 fingers up from the bottom of the vulva will make a stab with the needle. I guide the needle under the skin and have it come out about 12 or 1 o'clock around the vaginal opening. I then hold the umbilical tape in place and pull the needle back through the original hole. I make the stab incision on the opposite side, come out the top, thread the tape through the needle, then will pull the umbilical tape down through my stab incision and then tie closed. If I didn't get as much closure as I wanted, I may place a simple interrupted suture with the Buhner needle and umbilical tape. I have considered nerve blocks, but these cows have been through so much they generally don't care, and I often find cows respond worse to the smaller pokes than the bigger. It's a fairly simple surgery. Often I've done this one-handed as I've been holding the uterus in so it doesn't come back out with the other hand. Sometimes I've guided the farmer or the farmer's child through this. The uterus will involute or shrink down over the next 3 weeks. At that point, the farmer can remove the sutures. I've repaired if a uterus comes out a second time, but that usually will rip my sutures, and in general I recommend culling the animal if a second repair is needed, because the damage it typically does is so bad that we can't get positive outcomes, and it's more humane for the cow to stop there. After the uterus is in and it's sutured, I tell the farmer there is a 50-50 chance this animal will die within 48 hours. If you get it when it's a vaginal prolapse, I don't really have any concerns at all. But the stretching of the uterus, when that has fallen out, has stretched some big vessels. When you replace those stretched vessels and blood flows back into them, sometimes it's too much pressure and the blood vessels will burst. These vessels are big enough that the cow bleeds out and dies. There's nothing to do about it but hope. I used to recommend culling her as quickly as possible, but cattle prices typically deem it's better to keep her and hope she will be fine. If she is fine, keep her while she raises her calf. It's less work on you if she can do the raising of the calf. Once she weans her calf, it's time to ship her. You don't want to risk a repeat at the next calving. So yeah, when you eat your next steak dinner, you can wonder if this cow had a prolapse and it had to move on from the farm. A few other notes. I'm not a dairy expert, but if you are in your dairy and seeing prolapses, you may consult and make sure your nutrition programs are up to snuff. In beef cattle, I don't think there's a lot of nutritional changes you need to make. I think this is more bad luck. I've seen people apply a spike in the vaginal wall that exits through the skin on the side of the cow. I wasn't impressed with this when I evaluated it. Trust your vet if they recommend this, but I never adopted this. What it does is hold the uterus in place and allows the calf to come out without us having to worry about removed sutures. In other species, I generally do the same thing as in cows if they prolapse. If it's a dog or a cat, I recommend spaying as well as some suturing. And I certainly will do more sedation on those animals when I work on them. So yeah, that's prolapses. I find them rewarding and fulfilling, as I like getting things in the right holes. And in general, the more you do, the better you get at it, and the more you enjoy them. I'm Dr. Nathan. Thanks for listening. I hope our discussions are valuable to you and aid in giving perspective. If you want to contact us, please reach out to theveterinarypodcast@gmail.com. You can find a complete list of the podcast episodes on SoundCloud. If you find this information helpful and want more content, please join our Patreon, patreon.com/theveterinarypodcast. And don't forget to follow our Facebook page, facebook.com/theveterinarypodcast. As always, thanks for listening, and I hope this information is helpful to you. If you do find it helpful, please like it, share it, so other people may find it helpful as well.